Okay, so, right. So what we're going to look at now is an introduction to the concept of toxicity, which basically means toxins are things that inhibit normal biological function, or poisons. Now, we may come to the conclusion a person has a toxin problem, either right at the beginning or later on in the process of taking the eyes through into distortion. What we know is the eyes into distortion position to access this will be the eyes to the left, straight to the left. Now, we don't like doing eyes into distortion and maintaining them in that position because people tend to take it out of that position a little bit and let the eye come back more towards the middle, and then they lose the neurological effect. So the habituation, as it's called, which is taking the eye position in, out 3 or 4 times, allows the neurological response to last about 10 seconds. So you get this habituation where the muscle will go into weakness when you do a repetitive eye position. And this tends to indicate a person has got a toxin. And that toxin could be one of thousands and thousands of possibilities. So we have to divide those possibilities down into metals, which inhibit enzymes from functioning, chemicals, which can inhibit genetic function, and radiation, which can damage genetic function. Okay? So those are the 3 sort of categories that we look at. And we're going to spend a little bit of time on each one, with most of our time spent, first of all, with the chemicals, because they're the things that we're exposed to with the greatest amount. And it's quite amazing how many kilograms of chemicals we put on our body. Okay? Now, Jill was just talking to me earlier. Males are getting as many chemicals in many cases as females now. Male grooming is becoming a big, big thing. Coloring the hair. What was the one you said about beard? Beard oil now is becoming popular. You've got to have a beard, apparently, to do this. But creams after shaving and things and before shaving, they're all sort of coming in. Of course, a lot of men spray deodorants under the arm, use face creams and things. But for the ladies, you know, it's more obvious from every single aspect of just how many potions people put on. And when you start to read the labels, they look quite frightening. But of course, the way the labeling in Europe is now done in America is you have to put the Latin name of the plant, which sounds pretty threatening, because you think, oh, I know the name in English, but that doesn't mean anything to me anymore. Even water you have to put down as aqua. You're not allowed to put water because it's not an international language. And of the components with things like aromatherapy or essential oils, have to have them all listed as far as what the ingredients are within each one. So a lot of things sound chemical, but are actually a perfectly natural origin. But on the other hand, there's a lot of pretty nasty stuff there which can cause irritation. And you've got the possibility that a natural substance can as well. So there's a perfectly natural substance that can cause nasty irritation with people. Take a stinging nettle, for instance. You know, it's a natural substance, isn't it? But you would want to put it over your skin or rub it on because you get a histamine reaction. So toxicity can be things from outside the body, and as we'll see in a minute, it can also be things from inside the body generated. But it is the root of many, many problems. Now, the person coming in on their first visit may sort of indicate they're a bit low in their energy, and you may have to deal with that first. And then a little bit along the pathway on their 2nd, 3rd, 4th visit, they may suddenly start to show that they've got a toxin. It doesn't mean that it wasn't there before. It's just that you've got to a deeper level, and they're now at a level of their health where they can start to say, yeah, I don't mind getting rid of a few toxins, a few metals and things deep in the tissues. So it can come up on the beginning and it can come up later on. So, but it is there, and it causes, as we saw with the enzyme pathway, inhibition. Toxins inhibit enzymes from functioning. So to maintain homeostasis or balance or harmony in the body, we have to have a balance. On the one side, we have to have sufficient nutrients coming in from our diet, all the goodies, and on the other hand, we have to balance it against the toxins. And part of the aging process is a build-up of the toxins. They get heavier and heavier, And so the amount of nutrients that we have to take in order to activate and stimulate the enzymes which detoxify also increases. Okay, so this is what happens a lot of time, is that people as they get older get more and more clogged up with chemicals, toxic metals, exposure to radiation, etc. But their diet gets worse. You know, they may be living on their own, or they may have dental problems or lost their teeth altogether and then don't eat properly and only eat meals on wheels and things without any real nutritional value. So the toxin then can build up and up and up because you're unable to detoxify. So understanding how we detoxify with the right nutrients and herbs and spices, etc., is very important. And as long as you keep a balance between the bad guys and the good guys, you're all right in homeostasis. But once it tips more one way, you're starting to have inhibition of your enzymes and your general health will go down the swanny. But sometimes quickly if you're exposed to high levels of toxin, and sometimes at a slower rate for most of us. So it's a combination of those two. So as our toxins build up, the scales go against us. And those toxins can be exogenous, in other words, outside of the body, or they can be endogenous, in other words, created from inside by the natural breakdown of certain compounds in the body, like hormones and neurotransmitters, etc. And also a lot of toxins which we generate within our guts, you know, byproducts from dysbiosis. So toxicity, internal chemicals are neurotransmitters, hormones, and ones generated by the mind. So we can generate hormones and neurotransmitters or neuropeptides in excess from our thinking process. So our thinking process relates to the generation within the hypothalamus of certain neurotransmitters going up and other ones coming down. We can also from external chemicals. Now, external chemicals which are not in the body, anything which is not of the same substance as in the body, is a xenobiotic. Xeno means strange in Greek. Okay. So xeno means strange, so it's an abnormal chemical. If it's an abnormal chemical, it has to be detoxified. The body can't use it because it doesn't know what it is. Okay? There's no structure made of this xenobiotic, so it has to go through a process of being eliminated. And sometimes things don't have to do anything, and our bowel takes charge of it and gets rid of it very quickly. Okay? Great. Okay? So you don't want to take something which stops your bowel getting rid of something because otherwise you're holding on. Sometimes you simply pee it out. You know, you get dehydrated, so you have more water, and you pee the toxin out. But sometimes they don't, and these ones that don't are the more fat-soluble and not water-soluble substances. And they have to go through a process of making them more water-soluble in order to be able to pass them out better. Okay? And that phase 1 or water solubility is called hydroxylation. So we can add an OH, so it makes it more water-soluble in order to be able to pass it out either through the liver or through the urine. So toxins can be chemicals. They can be metals. Now, metals are dealt with totally differently from chemicals. Chemicals have their own detox pathways. The toxic metals are passed out in a different route, which we'll discuss when we deal with toxic metals. And lastly, exposure to radiation. And this, what we're really after here with radiation, is ionizing radiation. In other words, ones which act as ionizing agents and can damage, therefore, the DNA, cause oxidation to our DNA. And these would be radioactive isotopes in high amounts. So this would be your strontium, your cesium, your uranium, etc., etc. And electromagnetic stress. So if we're in an environment where there's high levels of electromagnetic stress, this person may be suffering from the effects of electromagnetic radiation. The problem is they come into your treatment room and they've left their mobile phone or whatever it might be in the waiting room, so you may not see this. You know, if they're suffering from, say, geopathic stress effects in their house, and they come into your house and it's a nice house, they may not show the fact they're getting exposure to geopathic stress. So we've got to find ways of saying, now, how do we put the person back into the house, or see if we can find out why it is a person's possibly got geopathic stress, but they're not displaying it actually in the treatment room. So we have to remember this, and I like to treat my patients with all their trinkets on. Because a lot of people come in and say, oh, should I take my watch off and my jewellery? No. Not if you wear a watch and jewellery. Stay as you are, okay? Because if you take that off and it's a problem, you won't see it, okay? So it's far better to examine the patient with all their things on. It's exactly the same as we were taught at osteopathic school and by Dr. Goodhart with applied kinesiology, is you test the patient in the posture mechanically of when they get the pain, okay? If I get my pain standing up, or my patient gets the pain standing up, and I test them lying down, I might not get anything to show. The muscles may not be strong, or may be strong when they should be weak, etc., etc. If anything changes when you change position, you know, this is a mechanical problem. So you test the patient in the position when they've got their symptoms. Okay? So the same thing applies often with the chemistry, is you really need to test the patient chemically when they've got their symptoms. Okay, and it's a nuisance, isn't it? Because sometimes people get the symptoms in the middle of the night. So what we have to learn is how do you put that then and now technique where you change the body clock and find out when the issues are that the person's got. Now, we've seen it with the definitive meridian. In Elizabeth's case, what we saw is the liver. And you go immediately say, liver. It's 1 o'clock till 3 o'clock, isn't it? But of course, we're in summer saving time now, so it's 2 o'clock to 4 o'clock. So this is the time when she's most active, her meridians are most active. And that's probably, do you wake up during those times? You don't go to sleep till after that. There you are. And that's why, because the liver is trying to detoxify. And you say, well, what's it trying to detoxify? Because that's its primary job. And it's not just the liver. You know, don't be at all surprised if you took tissue extracts on and she didn't actually strengthen to liver extract, because detoxification, which is the function of the liver meridian, occurs in all cells in the body. Okay? It's the meridians are associated with the physiological function, not the organ. Okay? Get away from thinking it's only the organ, it's what the organ does. Okay? So the liver is about detoxification. So people often say, oh yes, you're right. I wake up and I don't get back to sleep until a certain time. And every night it's usually the same thing. And often, you know, with livery things, I find if you're having trouble detoxifying, you get dreams. You know, sometimes these dreams can be horrible. And, you know, as an adult, we often don't, you know, most of the time, thank heaven, we don't get dreams. Do you remember you had a lot of dreams, horrible dreams as a child? And then you sort of grew out of it. And the reason for that is because you're much more, the blood-brain barrier is much more leaky as a child. Okay, so chemicals in the diet or in the environment get across the blood-brain barrier much more as a child. When you get to 13, 14, the blood-brain barrier sort of gets thicker and seals more, so you don't get those nasty chemicals going across, all right? So you don't have the nasty dreams anymore. So when you have a nasty dream now, just simply say, well, what did I eat or drink, okay? So you then find out, you know, a lot more what it is. Okay? Now, I'm a green, and some of you are greens. Mostly the boys we discovered are more green. You don't get so many green girls because you don't get so many tall people, but all green people are sensitive to alpha-solanine. And alpha-solanine is a toxic substance, an alkaloid substance, which is present in the deadly nightshade family, potatoes, aubergines, tomatoes, and peppers, in varying amounts, depending upon the age and quality of the product. And if you hit a magic point or threshold above which your body can get rid of it, it has disastrous effects in the body. It paralyzes the parasympathetic nervous system. Okay, so you go into a deeper sort of state of sleep, then you wake up and you get the worst dreams. And it's always potatoes with me, and you've got to be so careful with potatoes as a green person, because if you are sensitive to alpha-solanine, you just got to watch those potatoes. And I love new potatoes. And new potatoes are the worst because the skins are thin and the light changes the solanine and makes it very toxic just under the skin. And they go green. But you don't always see that green. Okay? The green is the toxic substance. That's the alpha-solanine, which is the poison. But you don't always see it because it's underneath the skin. It's only when you peel them, because you don't normally peel new potatoes. But if you've grown potatoes, new potatoes, if you dig them up, put them on the lawn and it's a sunny, you just let them dry, they'll be green within an hour or so. Okay? Old potatoes, you know, as late crop, I don't mean old in age, but late crop potatoes, have thicker skins, and you can leave those out in the light for much longer. This is why, for me, I can have old potatoes, and they cause very little problem. But if I have small or new potatoes, they're much more deadly than the older potatoes. Interesting, isn't that? Okay. So there's only one cure for me. That's to kick me out of bed, usually. Now, I have to go and have lemon balm, Melissa officinalis. That is the antidote to alpha-solanine. It's a wonderful substance, apart from not having potatoes, tomatoes, peppers, and aubergines for at least a week. You're banned from having them from then. But you have to avoid them, obviously. And we used to go to Athens a lot, didn't we, a few years ago before the collapse of the economy there. We went about every month, I think. And every month we'd come back hardly able to walk on a Sunday night to get on the aeroplane. You know, it was terrible. Because we'd had 3 days of the Greek salad, which is green peppers, potatoes, tomatoes, and aubergines. And that aubergine dip was my favorite always with it. But it was deadly because it just hit the neuromuscular junctions. It paralyzed the acetylcholine. And so you could hardly walk. You know, it was terrible with it. And then I would down a bottle of lemon balm when I got home. I'd always forget to take it with me, but I down it when I got home, and it was wonderful. Within half an hour, things were back lively again. So lemon balm is the antidote. Capsules will work. Test whether it's capsules or whether it's liquid, but that is the finest antidote to alpha-solanine from deadly nightshade poisoning. Okay, so there we've got our chemicals, toxic metals, and radiation, and we'll be looking at each one in more detail, and we need to do it in a way that can differentiate when a person's got a problem